Some medications some people do really well for long periods of time. And I find that people that clear on a biologic, they stay clear for a long period of time. People that are 90% better, stay 90% better for a long period of time. Some of those people that do 75% better it kind of wears off sometimes. And so then you have to figure out whether it's just a temporary flare because they're going through a stress event, or is it just not working anymore? And then you have to pretty much switch to another medication. I think the question really boils down to is how much do people tolerate? And I did my own investigation of this. And I think if people have less than 2% body surface area, you know, on the leg, on the back, they're really not that bothered by it. I mean, so if you were on a biologic agent, you had 10% or 20% or more, and you're down to 2, very few people are bothered by that amount. When it starts getting more than that, I think people are upset by it. No, I've tried that. I've tried to organize that. I've tried to have their own group sessions, but it's always phased out. I've tried it like 3 or 4 times, and once I start it's not supposed to be about me. It's supposed to be about them, and it hasn't been. I don't think it's been all that effective. I do believe, however, today, because the treatments are so much better, and they've actually studied it, when you treat somebody effectively, their depression and their anxiety levels go down significantly. Let's take a step and look at what we have. Some of the TNF inhibitors and ustekinumab can make you 75% better within 16 weeks. About 3/4 of all people will get 75% better by 16 weeks, maybe 80% better by 24 weeks. Some of the new IL-17s can make you 90% better 60% of the time within 12 weeks, 100% better 40% of the time. So we're getting to the point where, let's say, 40% of the people can be clear, 20% of the people can be 90% better, another 20% of people can be 75% better. So we're dealing with about 80% of people that are doing very, very well. And some of these medications, like for instance with ustekinumab, is 1 shot every 12 weeks, so people are very pleased with the infrequency of treatment. We're going now into, with the IL-17s, as I mentioned, a much higher efficacy, and there's the development of new medications, IL-23 inhibitors. IL-23 inhibitors, which IL-23 activates T helper 17 cells, which result in production of IL-17 and IL-22. There's P23 is composed of 2 components, P40 and P19. This is a P19 antibody. It knocks it out. And so therefore T helper 17 cells can no longer produce their molecules. And these medications seem to work even more efficacious. Like you might get PASI 75s in the 90%. And also they also may be in frequent use, like every 8 or every 12 weeks. So I think that's the next stage of development of psoriasis treatment, which will, if they're just as safe as the others, will again allow for people to be clear for longer periods of time without having to take shots, as many frequent shots.